This is Dr. Shemen, and we're going to discuss now issues regarding the parathyroid glands. As you can see here, the thyroid, which is also a hormone gland, sits on top of the trachea, the windpipe, and the larynx. The thyroid produces thyroid hormone. Typically, most humans have 4 parathyroid glands, and here you can see on this back portion of the thyroid that there are 2 parathyroid glands. These are slightly larger than in real life, but it's for demonstration purposes. The parathyroid glands are responsible for maintaining your calcium balance in your body, so that if you are overproducing parathormone, which is the hormone that the thyroid glands produce, what happens is it leaches the calcium from your bones, and that calcium can form stones in your kidneys or in other parts of the urinary tract. It can cause pancreatitis. It can cause a host of different problems that patients may experience. Most important is that the bones become brittle because the calcium has been leached from them. As a result, it's important for us to identify which, if 1 or 2 or all of the parathyroids are involved, and remove them surgically. Now, in order to identify which parathyroid gland is in fact the troublemaker, what we do is we have these patients with overactive parathyroid disease undergo radiologic imaging. In this practice, what we use is ultrasound and CT scan, very fine-cut CT scans. And by that means, we're able to identify which of the 4 parathyroid glands, or all of them, are involved with the process. Most commonly, what we find is that there's 1 gland that's involved. We identify this before the operation, which gland it is, and then we go ahead and take the patient to the operating room. Typically, this surgery takes only 25 to 30 minutes to remove the offensive parathyroid gland. However, at the time of the surgery, what we do is we send off what's called an intraoperative parathyroid level. And by that means we can confirm that the parathyroid that we've removed is in fact the offensive parathyroid. We then complete the case. If the parathormone has not declined, then we can of course explore the other 3 glands and see if they enlarged as well. Parathyroid surgery is very successful. Most patients are cured by that 25 or 30 minute operation. However, some years down the line have another gland that overproduces parathormone, and we can then return the patient to the operating room through the same incision and remove the other offensive parathyroid. If you have any questions about your parathyroid, if you are producing too much calcium, please give us a call in the office at 212-472-8882, and we'll be happy to see you. Thank you for your attention.